Hello and welcome to our CPD on what is the role of the standardised patient in T Level Health. Let's start with some introductions first. So you've got myself, Tracy Hutchinson, and my role is Provider Development Officer, where I support providers in the teaching and learning. My background is teaching in health and social care in FE, and I have brought these expertise to NCFE to create CPD to support providers in teaching and delivery. And I am joined by Karen, who would like to introduce herself.
Hi, my name is Karen Bark and I'm the Subject Specialist for Health within NCFE. I work predominantly on the T-Level Health and Science qualification, and I've got 15 years previous experience of working in health education and also previous experience of working in the health sector.
Thank you, Karen. So the aims and the objectives of today's workshop. So the aim of today's workshop is to explore the role of the standardised patient in health education, making links to how to prepare sort of yourself, teachers, for the T-Level Employer Set Project, or ESP. We'll explore effective standardised patient in practice and help you develop the confidence to take on the role of standardised patient in your delivery and assessment to have that positive impact on your students' learning experiences. We will also share best practice from your fellow colleagues from our recent workshop. So our agenda today. So the agenda is as follows. There will be a brief overview of the ESP tasks. However, the main focus will be in relation to task 2A, which is the key task for the standardised patient. We will look at the role of the standardised patient with a focus on effective portrayal and how to incorporate this role in teaching and delivery. So moving on now and actually looking a bit more detail of what the standardised patient is in the employer set project. So really focusing on that task 2A. So we have the 5 assessment objectives in the ESP. So from AO1 being plan the approach to meeting the project brief to AO5 realising a project outcome. 56% of the marks come from the application of the core skills, so that AO2. And the 2 primary core skills we will look at today is person-centred care and communication. But we'll also touch on AO4 briefly today in relation to these 2 core skills. So these are the summary of all the tasks that we had in our recent sitting. So task 2A, student, prepare and ask questions to a standardised patient, is the task that we will focus on. So should you wish to find out more about the other tasks in details, please feel free to visit our YouTube page where we have recordings of previous workshops on the core assessments, which goes through each of these tasks in more detail. So let's look at sort of the marking for task 2A. So task 2A is worth 20 marks. So focusing on the assessment outcomes and marks linked to 2A, 12 of the 20 marks come from the application of those 2 key core skills, with the rest awarded across AO1, AO3 and AO4. So let's really break down this task, this role play in a bit more detail. So students' time is split into pre-role play, which is 30 minutes, during the role play, which is 30 minutes, and then post-role play, which is up to an hour. So this is about students using the first 30 minutes to prepare questions from their task 1 and pre-research time. During the role play, completing notes, and finally in that final hour, really expanding on those notes and reflecting post-role play and post-task 1 also. US providers get the briefs 7 working days prior to prepare for the role plays, as students can pick from any of the 5. However, you can suggest to students which brief would be the most beneficial one to choose. For example, based on the occupational specialism you'll be studying next year, we'd recommend choosing patient X. However, you still have to leave the choice up to your students to pick which one they would prefer to do. So let's look at those core skills in relation to that general competency framework. So linking back to the AO4, where 2 marks come from the English and maths competencies. Here is an outline of the competencies and how they link to the core skills. In regards to communicating using maths, students may use data to support their reasoning or justification for support or care options a patient should have. So that's how you would link that CMC 8 with that CS 2.2, so how to communicate using sort of numbers and statistics in a supportive discussion. So we broke down these core skills in a bit more detail, and we asked our providers, first of all, so your fellow practitioners, how do you think students could demonstrate person-centred care in the role play? Some great examples were shared, which you can clearly see here, from empowering patients by acknowledging or meeting the patient's needs and taking into account preferences, looking at holistic care, and even those communication skills and active listening, which, even though is a skill by itself, is also a fundamental part of the person-centred care skill. So what does our spec say in regards to these core skills? So that CS 1.2, provide person-centred care. Well, actually, it lines really well with the suggestions made by your peers. Showing respect and dignity when communicating, ensuring what is proposed is in line with equality and diversity, and showing that compassion throughout, such as asking questions, acknowledging their feelings, making sure that the patient is okay. So after exploring what your providers thought would be a focus of the person-centred care, we asked for some feedback on how do you think students could demonstrate communicating effectively within the role play. Some really fantastic ideas again, taking into account different verbal and non-verbal communication factors, as well as showing attention through active listening and body language, and additionally thinking even about the layout of the room so that it can actually allow the students to demonstrate this skill effectively. And again, key areas from the spec aligned with this CS 2.2, and that was really fantastic, showing that both your peers and the spec align with that importance of effective verbal and non-verbal communication, communicating without that medical jargon, and effective questioning techniques. And for example, active listening, which could be demonstrated through simply students reiterating what they are writing in their notes to show they understand, and gives opportunity to follow up questions. So that's both active listening, communication skill, and even that person-centered care, showing that they've listened and understood. So let's now look at the role of the standardised patient and look at that a bit more detail. So again, we asked one more time for your providers to share some of their ideas of what they thought the role of the standardised patient is. What they made very evident is about supporting your job is to support the students. That is very clear, to help deliver an authentic experience and provide an appropriate patient simulation to guide learners. And I think the example there, assess and evaluate real life patients, is, even though it could be seen as a student specific one, is also a really important part of your preparation for the standardised patient role. So what is the role of the standardised patient? It is a person who takes on the characteristics of the real patient. It is the role of a standardised patient is to independently, consistently and accurately convey details of the patient's life in an appropriate and consistent manner. Tutors or subject matter experts can take on the role. However, they should ensure that they have appropriate subject knowledge to understand the nature and complexity of the role. This role is really about supporting students to complete that task 2A. It offers that standard base for all students completing the project, but it reduces that risk of having to use real patients. So why is a standardised patient needed in health education? So why are these students doing this? This type of assessment is needed as the skills are really prized by employers, universities. Universities use it as an assessment method, so it's a really great way to expose them to it now. It increases their confidence in a role by teaching those key clinical and personal skills. And it's really a beginning of that student professional development and really strengthening those verbal and non-verbal skills in an authentic way. So I'm now going to pass you over to Karen, who's going to go through the role of the tutor as a standardised patient in more detail.
Okay, so firstly, let's look at some standardised patient top tips. So if you are taking on the role of the standardised patient within the role play task, here are some top tips for being an effective standardised patient. So firstly, research the principles of good practice in presenting simulated patients. You should read around the subject prior to taking on the standardised patient role. NCFE recommends the following reading material: the Simulated Patient Handbook, a comprehensive guide for facilitated and simulated patients by Fiona Dudley. This handbook provides guidelines on the essential skills of characterisation and supports standardised patients to learn best practice. You should also have the relevant brief available to refer to during the role play. It is important that you do try to memorise patient details from the briefs, but you can also refer to the brief in the actual role play when required to ensure that you're answering the questions from the student with the correct information. For example, if the brief states that the patient has mobility issues and has fallen at home, then you should refer to this when being asked about support needs. This may prompt a further line of questioning from the students about mobility aids that may be able to support you as a patient. Should also remain in a specific patient character when responding to questions. Although the student may know you as their tutor, it is important that you act as a patient throughout the role play and do not refer to answering questions as anything other than the patient from the brief. This will support students to also remain in character within their role. It would be recommended to remind students of both of your roles prior to starting the role play task. Play the role in a convincing but not melodramatic manner. It is important that, as previously stated, you remain in patient character, but if you play the role too over-emotional, this can be off-putting for students and take away from the aim of the task for them, which is to gain information from you as a patient. You should answer the questions based on the information given from the brief and refrain from communicating in an over-emotional way, for example, pretending to cry. Another top tip is being mindful of your body language. Body language, as we know, is a very important part of communication. So it is important that your body language remains open to put the student at ease when they are asking you questions. You should have an open posture and don't cross your arms. You should also have good eye contact and include gestures such as nodding when being asked questions to show that you are listening to the question. It is also important to be aware of your facial expressions, as these can convey emotion. So if you look very stern, the student may feel that you are unhappy with their line of questioning. You should also use language that is appropriate to a typical patient. Patients will generally not use medical technical terms, so refrain from using overly medicalized language when answering questions, as this may confuse students. You should avoid embellishing the condition in a misleading way. Although it is important that you appear authentic as a patient, you need to ensure that you do not over-exaggerate the condition that is described in the brief, but just use the facts from the brief and what is appropriate to the task when answering questions. For example, if the brief states that the patient has memory issues, you should not state you can't remember the answers to some of the questions being asked, as this would be detrimental to the student. Play the role consistently so that every student's experience is the same. For each brief, you should ensure that students are not provided with different answers to the same types of questions. It may be useful for you to make notes about each of the briefs based on questions the students may ask to refer to within the role play. If more than one tutor is playing the same patient from a brief, you should set up a standardisation session prior to the role play to ensure that you're all consistently playing the role play from each brief in the same way. From this standardisation session, you may also develop standardised notes to use within the role play. You should repeat information that a student has not understood. If a student has not understood an answer that you've given, you are allowed to alter the wording you use so that they do understand. You are permitted to rephrase your answers. However, just be careful not to change your answer too much to give the student an unfair advantage in comparison to other students. You should always ensure that your approach to answering the questions is consistent across all students. Avoid tips or prompts. Be careful not to provide tips or prompts to the students about what they should be asking, as this can make the assessment less challenging and provide them with an unfair advantage. Avoid leading answers and only base your answers using the information from the brief and what is relevant to the task. For example, if the student asks a question that is not relevant or reasonable, you should not respond with what you would like to know about something else, which you as a standardised patient feel will be more relevant for the student to ask. In this example, it would be more appropriate for you to answer the question by saying that the question is not relevant or that you are unable to answer. You should practice being a standardised patient. To support you with the standardised patient role within the assessment, plan some time to practice being a standardised patient with students prior to the employee set project assessment so that you become more confident and familiar with the role and how to answer questions appropriately. This also gives the student the opportunity to practice asking questions as a health professional. You should position yourself appropriately to aid communication. It is important that you face the student when answering questions so that they can not only hear your verbal responses to the question, but can also see your body language. Sit and facing the student, support and engaging them in conversation and avoid them missing any non-verbal communication you provide with your verbal answers to questions. And finally, you should avoid giving short, close answers to relevant questions. Where a student has asked a reasonable question that is relevant in the case study, you should respond in an appropriate way, including giving information on parameters that may not be explicit in the case study. For example, if the student asks a question about what your goal is for return to work, you can give an answer with a time frame, even if the information is not detailed in the case study, as this is a reasonable and relevant question related to the case study. Now let's look at how to effectively portray the standardised patient. The table on this slide shows a summary of an effective versus an ineffective standardised patient. So an effective standardised patient responds appropriately to the student to support in further discussions using information from the case study and what is reasonable or relevant to the case study. Whilst an ineffective standardised patient doesn't give full answers to questions that are reasonable and therefore effectively shuts down the line of questioning, even if it is relevant to the case study. An effective standardised patient is confident within their role as a standardised patient and understands requirements for answering questions using the guidance document provided by NCFE. Whilst an ineffective standardised patient lacks confidence as to what their role is as a standardised patient and isn't sure how to answer questions the student asks. Finally, an effective standardised patient provides a consistent approach across all students in responding to questions with the same level of detail to similar questions. Whilst an ineffective standardised patient is inconsistently responding to student questions. For example, providing more detailed answers to some students and close short answers to others. We will now look at an example from the sample assessment material. Throughout the rest of the recording, when we are drawing on examples, we will be using Joe from the sample assessment material. You can access the case study through the link on this slide. Let's now look how Joe could be effectively and ineffectively portrayed through the standardised patient response. We know the following about Joe. He's a proud and independent man, and Joe could be resistant to anything that seems to remove or significantly infringe his independence. Your response to show Joe's independence without being melodramatic or not allowing students to respond and show person-centered care or communication skills. An example of a student recommendation could be that you have shared that you are having mobility issues at home and there are instances where you forgot to take medication. In order to review the support you need at home, I feel that you need to be referred to an occupational therapist. An ineffective portrayal of Joe would be an over melodramatic response such as, no, I will not do that, I don't need anyone. An effective portrayal of Joe would be a measured response such as, I'm not sure that I need anyone, why would this help me? This example would allow students to respond with possible reasons why this would help him. For example, it will help to better support his wife. It will be easier to refill the bird feeder. It will give him more opportunities for gardening and help with guitar playing, as he's unable to do this at present. Let's now look at the setting up of the ESP. It's important when setting the ESP roleplay task up that the environment is correct. Setting up the environment correctly can allow the opportunity for students to show dignity, respect and person-centered care. For example, it can allow them the opportunity to knock before entering, to respect privacy and confidentiality, and to face each other to allow for eye contact. The camera should always show students fully, and the role play should take place in a separate, quiet space. This gives the students the opportunity to get marks from the moment the role play starts. We're now going to move on to looking at the breadth of standardised patient answers. Let's look at the example of Joe and applying the top tip of avoiding giving short, close answers to relevant questions in relation to the breadth of the answers. An example of a student question could be, you've shared that you value being able to feed your birds. Why is this important to you? An example of a closed answer would be, because I like my independence. A relevant response could be, it's important to me because I like my independence. Since retirement, this is an important responsibility for me. I value this hobby, and that is why I get agitated when Sheila does it. In relation to the case study of Joe and breadth of answers for the standardised patients, it would be appropriate to communicate if you were answering as Joe the patient that he doesn't believe there is anything wrong with him when being asked about his symptoms, as this is mentioned in the case study. It would be appropriate to communicate reluctance of any support, as the case study has mentioned about reluctance to see a GP. It would also be appropriate to communicate feelings, including frustration, agitation, upset, and being a burden on Sheila. These are all mentioned or suggested from the case study. I'll now pass you back to Tracy, who will continue to talk about preparing for standardised patient role in teaching learning assessment.
Thank you, Karen. So let's first of all look at preparing to be a standardised patient and how this will support you in relation to teaching learning assessment. So it's important practice that the role of the standardised patient, because this really builds your confidence, and that is what both your fellow peers and Karen have both reiterated before, that need to practice to build that confidence. There is a tutor guide also with the Autumn Live series, which will be available post-assessment in the second term, which goes into this a bit more detail about the breadth of answers as a standardised patient. And additionally, there is a simulated patient handbook as previously mentioned by Karen. So let's move back to sort of how do we develop those core skills in our students. So there's performers available right now that you can use throughout the year. It's really important as well to start recording your students from doing tasks in the classroom, from maybe doing a sim session or a skills session, getting them to record themselves, record each other, review that, reflect on that, and sort of even do some peer assessment on each other's videos. And this is really important also to sort of develop those questioning techniques with your students, get them to do those probing and opening questions. And along with that Camry readiness, the students can then really reflect on how effectively they may have used those questioning techniques. They could even do some group discussions, group role plays, and really setting even roles in a group discussion. So if you're having a problem, setting a problem, doing group discussion, setting roles, so setting a speaker, a listener, a person that controls the speak, so they can really start learning how to listen to each other and then respond to questions and answer effectively. And when doing those professional simulated discussions, scaffold it. So start small, really, 2-3 minutes, get the students to reflect on it, look at their conversation, then build on that, making it a more sustained, longer discussion, really improving those listening skills. So moving from interview style questioning, so the student asking a question, the patient answering, to actually having a discussion. And creating templates that could be easily recalled on exam day. So a template that allows students to do pre-notes, that allow them to complete notes during, and allows them to then complete notes after, which could help guide them. So how do we prepare the students for the standardised patient? So it's about being familiar with keywords in the specification. And I think it's important the students are really familiar with the keywords in the spec in regards to the core skills and in the tutor guide for the ESP as well, because the word itself can also really help understand what is being asked of them. Students could also create their own scenarios, their own revision resources to help prepare for the exam. And it's about also teaching them how to use time appropriate. So both in the 30 minutes prior and in the hour after. That hour after is to really help support and prepare students fully for their healthcare plan that they're creating. And also they have access to a copy of their notes for task 4. Therefore, it's a really good opportunity to pause and reflect on the task that they have done so far. So let's now sort of summarise what sort of support that you can continue to get from ourselves. So our main area for you is the T Level support page. This is everything you have from bulletin to key dates to upcoming webinars. You will continue also to get your monthly support from your account executives and from ourselves at Provide Development. You have 3 curriculum consultations once you have registered. And we will continue to support you through emails and provide CPDs just like this, which we will continue to provide throughout the year. So just to recap what our aims and objectives of the session is, we were exploring the role of the standardised patient. We have explored how to become an effective practitioner and how to become confident in your role to have the best impact on your students. So I would like to thank you for joining us today, and please feel free to contact Karen and I in future. Thank you.